Hey everyone, welcome back to all my listeners. This is episode 15 in season 16. Today is Wednesday, December 10th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, so welcome back to another podcast episode. Now, I just enjoyed a wonderful time down in Savannah, Georgia at the 17th annual NAMUS conference that I was very honored to help sponsor this year. It was simply an outstanding opportunity for experts in the field to get their continuing education. We always have so many takeaways and smart and savvy nuggets to go home with and utilize in our everyday work. So I wanted to give a big shout out to all of the team at the NAMUS organization for providing a outstanding conference yet again. Next year, I've been told that it is going to be in the great state of Florida. So it's going back to Florida, where it has been a few years ago. So I'm very looking forward to a different location for the 18th annual conference next year. So looking forward to that as well. Anyways, and then of course, when I came home from beautiful, rainy, cloudy Savannah, Georgia, I came home to another 4 inches of freshly fallen snow here. So yeah, it's been quite a cold burst up here in the Midwest. We haven't seen this type of snowfall and ice coverage in quite a few years. So there's a lot of hullabaloo about, driving and traffic and walking and salting and, all sorts of conversations we have not had. It's been pretty quiet over the past few years with the relatively low snowfall levels. But anyway, we are in the mix up here. So anyways, hope everybody out there in my audience is staying cozy wherever you are. And I hope you are looking forward to Christmas, Hanukkah, and Kwanzaa in the next few weeks. I know we are ramping up for holiday season. So I hope everybody is shopping, everybody is decorating, everybody is baking, cooking, doing all of those things. I know I'm waiting for my son to come back from college. He's busy cramming for exams and things like that. So looking forward to seeing his face for a couple of weeks before he starts the second half of his semester, his year. So anyways, I hope you guys are doing great out there. So today's episode, it is the second week of December. So I'm going to be focusing, on the OIG Work Plan updates for the month of November 2025. And in my trusty tip, I'm going to go ahead and focus on chronic care management. I'm auditing and I'm seeing quite a bit of issues with documentation as I review. So that I know I've talked about before in a different season, but this time I really want to talk about what needs to be included in documentation for it to be a covered, reimbursable event. All right. And then I'm going to go ahead and close out and round out today's episode with a remarkable quote on resilience by Sir Edmund Hillary. All right, you guys, let's get into it. So in today's Newsworthy, the month of November's OIG Work Plan updates. There are 8 updates to the OIG Work Plan for the month of November 2025. The first is titled Audit of Certified Community Behavioral Health Clinics, Medicaid Reimbursement and Compliance with Demonstration Requirements. Now, this report is to be expected from the Office of Audit Services. Certified Community Behavioral Health Clinics, or CCBHCs, provide whole person, team-based care addressing both behavioral and physical health needs. They are required to offer a broad range of services, including crisis mental health care, case management, and integrated physical health screening. Section 223 of the Protecting Access to Medicare Act of 2014 authorized the creation of a demonstration program for CCBHCs. States participating in the CCBHC demonstration receive federal funds at the Enhanced Federal Medical Assistance Percentage, or FMAP, for qualifying expenditures and are required to implement standardized certification and payment structures for CCBHCs. The OIG will determine whether select states participating in the CCBHC demonstration program claimed expenditures that were eligible for the enhanced FMAP and whether select CCBHCs provided the services required to receive Medicaid payments. This final report is expected in fiscal year 2027. Now, the second OIG Work Plan update made for the month of November 2025 is titled Incorrectly Billed Visit Units That Trigger Outlier Payments on Home Health Claims. Now, this report is coming from the Office of Audit Services. Medicare requires providers to bill claims accurately to be paid correctly and promptly by Medicare Administrative Contractors, the MACs. During previous home health agency compliance work, the OIG observed claims where providers incorrectly billed single discipline visit units greater than 8 hours that resulted in overpayments equal to the outlier payment. MACs pay outlier payments on home health claims for enrollees who incur unusually large costs that are determined by the visit units billed on the claim. Nationwide home health claims data for the most recent 30-month period shows that the average duration of a home health visit is at 45 minutes. OIG's audit will cover Medicare outlier payments for home health visits for single disciplines that were billed in excess of 4 hours. OIG's objective is to determine whether selected home health claims with outlier payments complied with certain Medicare billing requirements. Now, this final report is expected in fiscal year 2027. The third OIG Work Plan update made for the month of November 2025 is titled CMS Efforts to Ensure Nursing Home Quality After Changes in Ownership. Now, this report is expected from the Office of Evaluation and Inspections. In recent years, regulators and policymakers have raised concerns about the relationship between changes in nursing home ownership and low-quality care, which can endanger resident health and safety. CMS requires nursing homes to submit updated information within 30 days of a change in ownership. In addition, CMS and state survey agencies can assess the effect of ownership changes on quality by conducting an on-site survey, making a state monitoring visit, and/or requesting additional documentation. This study will evaluate the extent to which CMS and state survey agencies take actions to identify and respond to declines in nursing home quality related to changes in ownership. This final report is expected in fiscal year 2027. Now, the fourth OIG Work Plan made for the month of November 2025 is titled Rebates for Medicaid Physician-Administered and Pharmacy Drug Claims. Now, this report is expected from the Office of Audit Services. States are generally required to collect manufacturer rebates on physician-administered and pharmacy drugs in order to receive federal matching funds for those drugs. Previous OIG work identified significant concerns with states' efforts in obtaining rebates for physician-administered drug claims. The OIG will follow up with select states to determine whether states have implemented controls to ensure ongoing compliance with federal Medicaid drug rebate requirements. This final report is expected in fiscal year 2027. Now, the fifth OIG Work Plan update made for the month of November 2025 is titled Recommendation Follow-Up, Ensuring that MAOs Submit Rendering Provider Identifiers for Applicable Encounter Records. Now, this report is expected from the Office of Evaluation and Inspections. A Rendering Provider National Provider Identifier, or NPI number, is a critical data element on Medicare Advantage, or MA, encounter records that, number one, identifies the individual who performed a healthcare service, and number two, enables oversight entities and MA organizations to identify individuals who may pose a risk to federal funds and enrollee safety. CMS stated that it requires MAOs to submit the rendering provider NPI number when it differs from the billing provider NPI number. A 2018 OIG report found that rendering provider NPI numbers were missing on 13% of 2014 MA encounter records for outpatient evaluation and management services in which the billing provider was an organization, which means it was a clinic or a provider group. The OIG continues to be concerned that the omission of rendering provider NPI numbers may impede oversight and program integrity activities. This new evaluation will review 2024 encounter data to determine whether MAOs are submitting rendering provider NPI numbers. This final report is expected in fiscal year 2027. Now, the sixth OIG Work Plan update made for the month of November 2025 is titled Audit of Centers for Disease Control and Prevention's Compliance with Federal Records Management Requirements. Now, this report is expected from the Office of Evaluation and Inspections. The Federal Records Act of 1950, the FRA, requires all federal agencies to create and preserve records that document the agency's organization, function, policies, decisions, procedures, and transactions. The FRA calls for agencies to establish a records management program consisting of policies, procedures, and activities to manage recorded information. The Presidential and Federal Records Act amendments of 2014 modernize records management by requiring the transfer of records from federal agencies to the National Archives and Records Administration in digital or electronic form to the greatest extent possible. Effective and efficient management of records provides the information foundation for decision-making at all levels: mission planning and operations, personnel services, congressional and legal inquiries, business continuity, and preservation of U.S. history. The OIG will conduct an audit to determine whether the Centers for Disease Control and Prevention complied with federal records management requirements related to, number one, responding to incidents of records removal or destruction; number two, training for federal employees; and finally, third, chain of custody for departing staff records. This final report is expected in fiscal year 2026. Now, the seventh OIG Work Plan update made for the month of November 2025 is titled Title 4E Adoption Assistance Program Payments. Now, this report is expected from the Office of Audit Services. The Adoption Assistance Program, authorized by Title 4E of the Social Security Act, provides federal matching funds to states to facilitate the timely placement of children whose circumstances would otherwise make them difficult to place with adoptive families. The Administration for Children and Families administers the program. Federal funding, which is contingent upon a state-approved plan, is available for a one-time payment to help with the costs of adopting a child, as well as for monthly subsidies to adoptive families to help with the care of the eligible child. In federal fiscal year 2023, 50 states, the District of Columbia, Puerto Rico, and the federally recognized tribes were awarded Title 4E adoption assistance payments of nearly $3.4 billion in federal shares, supporting over 560,000 children monthly. Using a risk-based approach, the OIG will conduct one or more audits of selected states' adoption assistance program payments to determine whether states complied with federal and state requirements when claiming adoption assistance payments for federal reimbursement. Now, this final report is expected in fiscal year 2026. Now, the eighth and final OIG Work Plan update made for the month of November 2025 is titled FDA's Oversight of Dietary Supplements. Now, this report is expected from the Office of Audit Services. The Federal Food, Drug, and Cosmetic Act, as amended by the Dietary Supplement Health and Education Act, gives the Food and Drug Administration, the FDA, the authority to regulate dietary supplements that are marketed in the United States. While the FDA does not have the authority to approve dietary supplements before they are marketed, FDA's role in regulating dietary supplements includes activities such as inspecting dietary supplement facilities, investigating complaints, monitoring the dietary supplement marketplace, and reviewing adverse event reports to identify products that may be unsafe. For the first phase of work, the OIG will identify the number of domestic and foreign dietary supplement facilities that are, number one, registered with the FDA by type, number two, due for inspection by the FDA, and third, that were inspected by the FDA. For the second phase of work, the OIG will conduct an audit to determine whether the FDA's oversight of select dietary supplement facilities complied with federal requirements. This final report is expected in fiscal year 2027. And now it's time for my best practice tips in Trusty Tip. Now, I have discussed chronic care management back in season 12 with all of my Trusty tips back then, but I am still seeing, here we are in season 16, I'm still seeing issues in documentation for current 2025 claims with a variety of payers. Lucky for us, CMS is still seeing issues as well, and they provided another education update in the MLN Connect last week. So I'm very grateful. The MLN goes over the facts that Medicare covers chronic care management, or CCM, which means managing a patient's multiple, which includes 2 or more chronic conditions. And that's a must. I've seen that missed. And folks just document 1 chronic condition. So CCM services for Medicare must have multiple chronic conditions, 2 or more, that are expected to last at least 12 months or until the patient's death. CMS also covers CCM and other management services for some patients with complex conditions. Now, they go over who is eligible, what's my role, how do I get started, and how do I bill? So remember, the details include for who is eligible. CMS goes over that facts that CCM are covered for chronic conditions, including, but these chronic conditions are not limited to, Alzheimer's disease and related dementia, arthritis, which could include osteoarthritis and rheumatoid arthritis, asthma, atrial fibrillation, autism spectrum disorders, cancer, cardiovascular disease, chronic obstructive pulmonary disease, COPD, depression, diabetes, glaucoma, HIV and AIDS, hypertension or high blood pressure, and substance use disorders. Now, they also cover CCM for some patients with complex conditions requiring moderate or high complexity medical decision-making, including, but not limited to, infection-associated chronic conditions and illnesses, including those with clearly identifiable infectious triggers like Lyme disease, difficult to identify infectious triggers like myalgic encephalomyelitis or chronic fatigue syndrome, conditions with potentially challenging, clinically challenging, or ambiguous diagnoses, as well as conditions with limited biomarkers for evaluation. Let's move on. They also include the details for what's my role, and that includes to develop a comprehensive care plan for optimal, reasonable, and necessary care. And that's where I see so much documentation that does not include that comprehensive care plan when I am auditing. So that is a must when we are documenting our CCM services. And if you're ever in a post-payment audit situation, you must be going back in the patient's record to find where that documentation for that comprehensive care plan is located and send that to the payer as well. Now, due to diagnostic uncertainty, the Centers for Medicare and Medicaid Services doesn't define these plans, but you must have a comprehensive care plan, right? When you're taking care of these types of multiple chronic conditions. Now, to develop a care plan, you may, for example, CMS says, conduct a thorough physical exam, do a broad and systematic differential diagnosis, evaluate prior laboratory evaluation and treatment histories. A comprehensive care plan focusing on managing the chronic conditions may include a problem list, expected outcome and prognosis, measurable treatment goals. Again, that's always a very good thing to include in treatment plans. Revision and monitoring per the code descriptors when necessary, cognitive and functional assessments, symptom management, planned interventions, medical management, environmental evaluation, caregiver assessment, interaction and coordination with outside resources and practitioners, periodic review. Due to a patient's complex needs, your care plan may also focus on ongoing evaluation of medical and psychosocial needs, coordination with specialty care providers as part of an interdisciplinary team, trust building aligned around shared treatment goals, encouraging a focus on improved quality of life. So all of these things are wonderful, wonderful items that should be included in documentation. And again, as I'm auditing, as I'm reading this list to my audience, a lot of my documentation that I'm seeing has none of this. So things like that from an auditing standpoint would be considered deficient for CCM services. All right, let's move on. So details for how do I get started? CMS includes details like before CCM services can start, CMS requires an initiating visit for new patients or patients who have not been seen within the previous year. again, that's a big ding that I see. Documentation included for an audit has not included that first initiating visit for new patients or patients who haven't been seen within the previous year. So for CMS, that is a requirement. So conduct the initiating visit during the comprehensive face-to-face evaluation and management visit, or during an annual wellness visit, or during an initial preventive physical exam. And finally, the details for how do I bill CCM services. And CMS includes details on viewing the chronic care management PDF for information on how to bill. And that is the exact PDF that I went over back in season 12. It is the MLN booklet on chronic care management services. So as I'm auditing claims in 2025, as I've stated throughout Trusty Tip, I'm reminding my CCM practitioners to include all relevant and necessary documentation to support their billed claims for their patients with 2 or more chronic conditions. Be aware, there is a lot of documentation that is required in a post-payment audit situation. And finally, I focus season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their insights on resilience. So in this week's inspiring quote in Spark is from Sir Edmund Hillary. It is not the mountain we conquer, but ourselves. So very true, right? This quote is perfect. This quote reminds us how much fear we have to overcome. The fear and the anxiety that paralyzes us from climbing the mountain, from mastering a new skill, or getting out of our own way. Sir Edmund Hillary reminds us that we must conquer ourselves before we can conquer the mountain that lies ahead. This quote speaks to the warriors in all of us. We can do it. I'm happy Edmund Hillary's spark burns brightly and continues to inspire so very many. All right, you guys, that wraps up today's short and sweet episode. Really hope you guys are looking forward to Christmas, Kwanzaa, Hanukkah, all of those holidays at the end of this month. I know I am looking forward to celebrating with my family and my friends the rest of this month. So I hope you guys nothing but the very, very best in the days ahead. Thank you all so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.